Innovation, air bubble science to retrieve stuck lenticle in small incision lenticle extraction. There is no financial interest. Small incision lenticle extraction in myopia is the safest corneal refractive procedure available today. However, few issues related to the lenticle dissection need to be addressed, especially stuck lenticle when it is attached to the top cap, residual stomal bed, or femtolaser air bubbles if they are absorbed due to delayed dissection. As a protocol, dissection anterior to the lenticle is done first. Inadvertent dissection posterior to the lenticle will make it stick to the top cap. Possible reasons for stuck lenticule are thin lenticles, opaque air bubbles, poorly seen or perceived demarcation of femtolaser cuts. As per the literature, this is the first attempt to address the issue of stuck lenticule. The air bubble science will help to retrieve the stuck lenticule. 100 eyes of 50 patients were observed from January to June 2023, willing for minimum 6 months follow-up. In 2 patients, lenticle was stuck to the top cap. In 1 patient, femtolaser air bubbles disappeared due to delayed dissection as patient was not comfortable. This obscured the landmarks for the dissection of the lenticle. Air bubble pattern of femtolaser and atmospheric air bubbles were used for retrieving the lenticle. This is air bubble sign 1. As femtolaser air bubbles get absorbed, atmospheric air bubble will enter the cavity and it will surround the instrument, indicating surgeon is trying to enter a plane which has already been dissected. As you can see here, when he is entering, there is an air bubble which is surrounding the instrument, and now he knows that he has to dissect in another plane to retrieve the lenticle. Due to repeated entry in a dissected plane, the cavity gets filled with the atmospheric air. So if you put a instrument now repeatedly, you may not see air bubbles surrounding the instrument, but there will be no force to the instrument, there is no resistance, which can be seen in this video. As surgeon is trying to enter, there is no resistance at all, but now air bubble sign 1 is not seen. Air bubble sign 3, if the dissection of the lenticle is delayed, femtolaser air bubbles will disappear. You can take help of air bubble 1 and 2 to dissect this lenticle. As you can see on the right side, there is hardly any air bubble is seen. In the video, you will realize that there are no air bubbles which are seen even under high magnification. Air bubble sign 1 and 2 is used to do dissection and retrieve the lenticle. Retrieve the stuck lenticle, we use a blunt on sharp technique. A sharp instrument is introduced below the atmospheric air bubble. After entering correct plane, blunt instrument is introduced above the sharp to retrieve the lenticle. As you can see here, there is sharp instruments already there. Above that, we are putting the blunt instrument, entering the right plane, doing the dissection, and removing the lenticle. All 3 patients with 2 stuck lenticles and 1 without femtolaser air bubbles underwent successful lenticle removal with good visual rehabilitation. Air bubble signs help to locate the correct plane of dissection. Blunt on short technique help to retrieve the stuck lenticle. To the best of our knowledge, air bubble sign for dissection and removal of stuck lenticle has been described for the first time. In conclusion, air bubble signs help as a guide for the lenticular dissection. It helps to retrieve the stuck lenticle. Lenticular dissection becomes easier. Results are good with excellent visual rehabilitation. These are the references. Thank you.
Very fine presentation, Dr. Ladi.
Thank you.
And when you're talking about air bubble, so this particular is useful only in lenticle dissections?
Only in smile, ma'am. Smile.
In
surgery.
smile.
In smile.
And the air bubble, you're not injecting, it is the atmospheric.
See, as we dissect the femtolaser air bubbles, the outside atmospheric air bubble will enter inside. Many times what happens in thin lenticle or when you have opaque air bubble, you will not know whether you are entering anterior to the lenticle or posterior to the lenticle. Thinking that you are entering anterior to the lenticle, actually by mistake you can go posteriorly, then it's a little difficult situation. Then these signs will help. So this is the only hitch which is there into a smile surgery,
Correct.
Which we try to address, so that, it is a last thing which can be treated well, and then it's the safest procedure now.
And if the air bubble is not there at all, I mean, if in any of the any particular
Yes,
case,
so the third sign, as I said, that patient actually had a visual. So by the time first right eye lenticle was taken out, he said that he started getting sweating. So anesthetist said you will have to wait. So we waited. And by the time I went to the microscope, there is no air bubbles. So there are no incision also was not seen. So then we located the incision from the direction where it was there, made a small nick there, and from there we use air bubble sign 1 and 2, because in that case you can go anterior to the lenticle also and posterior also. So air bubble sign 1 and 2 will help, and then you can remove this lenticle easily.
very.
But then you are saying when you went second time, there was no air bubble. So we understand that
No,
one sign
first-
you are saying that atmospheric air enters.
Yeah,
But what about the second?
first time when surgeon is going inside,
Yeah.
the phantom is not there, atmosphere will go in. So it will surround it. But if you try it repeatedly, then cavity will get filled by the atmospheric air. At that time, it will not surround the lenticle as a second or third or fourth attempt, but there will be no resistance to the instrument, indicating that we have to go to another plane now.
Thank you. Thank you.
Thank you. Thank you.